Okay, I should have also told you that. We are recording this briefing today because some reporters have already let me know they cannot attend but would like the recording afterwards. So, nobody needs to take notes or anything, and we can share it out afterwards. Hi, Jerry and Claire. Everybody, Jerry Cornfield is with the Washington State Standard. Claire Whitcomb is with the Seattle Times. Doug Bailey. I'm not sure. Hi, Doug. Can you introduce or tell us who you are?
Hi, I'm with Insurance Newsnet.
Great, thank you.
Sure.
Excellent. Okay, well, welcome everybody. We're going to kick it off. Today we are having a media briefing on the impact of Initiative 2124, which will be on the Washington State ballot this November, what the fiscal impact of that initiative would be on Washington's long-term care benefit program. We are also releasing an analysis that we have done of common consumer issues with private long-term care insurance policies. So we're going to start focused on the big landscape around long-term care finance and this initiative's impact. I should say that the initiative is written in a way that says that if you approve it, it will make it easier to opt out of the program as a working Washingtonian, basically turning the program from mandatory into a voluntary program. And with that, I'm going to lead off. Well, I'm going to introduce speakers, and then each speaker will give 2 or 3 minutes of comments, and then we'll open it up to questions. So today we are joined by Bonnie Burns of California Health Advocates. She's a nationally recognized expert on long-term care finance issues, including consumer, regulatory, and industry perspectives and issues. Norma Coe, who is a health economist and a professor and researcher at UPenn Population Aging Research Center. Judith Bendersky, a master public health gerontologist and former Washington State DSHS Office of Insurance Commissioner, and also has worked for Federal Center for Medicare. What is CMS? CMS. Kim Allen, who is a patient advocate in Seattle, and Gifford Jones, a retired airline captain and consumer and long-term care insurance policy holder. Jessica Gomez, who is with, she's the director of the We Care for WACARE's coalition. I think I got everybody. All right, Bonnie, kick us off.
Oh, good morning, good afternoon, everyone. I thought I'd start just by laying a little bit of a groundwork on long-term care, because when I say long-term care to people, their minds go right to a nursing home. And I don't think people have a good understanding of what it is we're talking about in the first place. So I would just say that long-term care in this country is a patchwork of public and private components without a common definition. And there isn't a good financing system for that kind of care. We have a looming public policy challenge with more and more people turning 65 and later needing long-term care services. So there's a huge jump in the number of baby boomers that are going to reach the age of 80 in a couple of years and 85 by 2031. Each state is dealing with the issue of an increasing percentage of their population that's in this age group and is subsequently going to need long-term care. We have 10,000 people a day turning 65, and that's been true since 2010, and it will be true until 2030. That's a huge number of people entering the ages where they're going to need long-term care. Rosalind, one of the reasons I'm involved in this is because I have daughters, lots of them. And I have seen my daughters go through this already with their husbands' family members. And Rosalind Carter said there are 4 kinds of people in the world: those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who need caregivers. And this is disproportionate for women. So that is one of the reasons I continue to be engaged in this topic, because women provide billions of dollars a year in unpaid care.
Mm.
And that is a topic that is addressed by the need for financing some kind of care. The average caregiver is an employed woman. She's balancing her home, her children, and caregiving. And it's a tremendous burden on women who then themselves take steps that affect their ability to pay for care later. So that is one of the reasons that I'm deeply involved in this topic. If you need care, you're not going to be able to buy insurance. You can't buy insurance if you need it. And if you have it, you may not even be able to keep it, because the premium increases over the last couple of years have been absolutely staggering. There are about 10 million people in this country who have long-term care insurance, and that number, it is spread across the entire country. That is not a financing mechanism for this kind of care. So Washington is the first state to have taken steps to try to address this issue and find a way to provide care for the residents of Washington. Other states are looking at Washington, and several states have introduced legislation similar to Washington's. California has 2 reports sitting in the state legislature now that offers 5 different methods for paying for this kind of care. And it's going to take a state approach like this, because insurance works off risk and people contributing the funds to pay for that risk. The larger risk pool that you have, the better this works. And so having the entire state involved in the program is a real benefit for providing care for the residents of that state later. It's not perfect. It's not lifetime. It's a beginning, and it has the potential to either delay or possibly even prevent care later in a facility because of the home care benefit. And it's something to really keep in mind. So this initiative then to make this kind of financing voluntary would absolutely destroy the program. People don't understand long-term care. They don't understand the need for financing or how it works. And it's a giant issue that's going to show up later in our tax bases, because it's either we're going to find a way to pay for it through this kind of a program, or we're going to pay for it through Medicaid, because it is going to be paid for somehow as people age and increasingly are a larger percentage of every state's population. And with that, I'll stop here, and if there are any questions, I'm happy to answer them or go to the next speaker.
Thank you, Bonnie. And yeah, let's hold questions unless somebody's got to jump off. Let me know, and we can take your question now. Norma, we'll move to you. Thank you.
Hi, thanks for having me. So I'm an economist, and I thought it might be useful to talk about insurance and how insurance works or may not work. So insurance works, as Bonnie mentioned, when you pool large groups of people together that ideally have diverse needs. Premiums can stay low, or at least relatively low, the larger the pool of people are. And that allows them to easily accommodate a large claim, right? So if you have a lot of people contributing small amounts of money, you can easily have the funds to accommodate a large claim. This is the same fundamentals that Medicare and Social Security run on. However, once the pool becomes small, and the smaller the pool, the worse, or if people are selecting insurance based on their own risk profile. So if you know that you're going to need long-term care, and thus you're insuring against it, that actually breaks down the entire insurance market. Premiums will have to increase the smaller the pool and the more selected the pool becomes. Premiums increase, that means the healthiest people again leave the market, and then premiums have to increase yet again. And it doesn't take long for the entire insurance program essentially collapses, and it can no longer exist. This is called the dynamic death spiral of insurance. Economists have great names for things like this, the dynamic death spiral of insurance, and it has happened in the health insurance market before. And it leaves the most vulnerable unable to get good insurance coverage. Making this program voluntary is essentially a vote to make to end the program. It just is not financially feasible as a voluntary insurance. And with that, I'll go to the next speaker.
Thank you so much, Norma. Judith, you ready?
Yeah, thank you. And I appreciate those of you that are on the Zoom to learn more about this topic. This topic of long-term care is the topic. It is one of the most expensive things in life that nobody wants to think about, nobody wants to talk about, and definitely nobody wants to save up for. And we all can understand why. So my name's Judith Bendersky, and just to clarify, my federal employment was with the Indian Health Service of the U.S. Public Health Service in Alaska, where later I worked for the health department managing the Medicare Information Office, and most recently the Office of the Insurance Commissioner, and am a public health educator and gerontologist. I've had the privilege of meeting with and counseling thousands of people in Alaska and Washington around Medicare and aging options, and helping people navigate the very confounding, frustrating maze of options or the lack of options. Most people that and not just older people, but younger people as well, especially athletic people who know that they could really hurt themselves badly hiking or skiing, or doing, extreme adventures, sports. But I've had young people with parents come into the office and say things like, the younger person, 30 years old, 35 years old, 20 years old, 18 years old, saying, my mom's had a stroke. What do we do? She used to have health insurance. She used to have long-term care insurance, but it got too expensive. And now I'm home. I'm taking care of her. I'm not working. Or a university professor and her spouse who has Parkinson's sitting down and saying, what do we do? I can't be a caregiver. I work full-time as a university professor. There's nothing set up for us. Medical insurance like Medicare takes care of medical things, but not the kinds of assistance a person needs. And the Walk Cares system that's in place now, which will be approving benefits for people in 2026, can help with really simple things like getting a ramp installed, getting a scooter, teaching somebody how to help their parents or their spouse get out of bed and into the shower safely. So lots of very practical things to help people get the care at home that they need. And again, people chip in a little bit on a regular basis as they work, and will hardly notice that. They will hardly notice that, but they'll get a huge bang for the buck later on. So it's this really it's a win-win. WaCares, as it's set up, is a win-win, especially for people who are younger and just can't even begin to fathom the idea of needing care and support. Thank you.
Thank you so much, Judith. Okay, now we're going to turn to focus on this analysis that we compiled of consumer complaints, just so that it kind of, folks understand what it looks like. As Bonnie said, very few people even have it. I think the latest figure I heard was 3% of Americans have a long-term care insurance policy. So in addition to the expense, there's some other challenges that can come with it. This analysis, which I've pasted in the chat here, found some of the most common issues that consumers have experienced are these big hikes in their premiums, which continue on even when you're not working and are on a fixed income. Sometimes companies will offer you the choice, big premium, or we're going to reduce your benefits. Which one do you want? So sort of forced benefit reductions. Also difficulty accessing the benefits they have been paying for. Policy denials on the basis of pre-existing conditions we'll talk about next. And then just claim denials and unclear processes to even get your claims covered. Barriers with communication that can be on the consumer part or on the insurance company's side of things. With that, would you like to go ahead and share your experience as a long-term care insurance policyholder who also registered a complaint with the Office of Insurance Commissioner?
Sure, be glad to. Rather than offering any system of prepared remarks, maybe it's just best to outline in general why I'm here. I was one of those that registered complaints with the Office of the Insurance Commissioner, so I've probably been in touch with some of you in the past. 3 or 4 complaints, actually, and they centered largely around the idea that my guaranteed or my suggested no premium increase policy increased several times. In fact, I bought the policy. My wife and I each bought policies in 2005. At that time, being relatively older at the time, my policy originally was $3,200 a year. My wife's was $1,600 roughly. And about every 3 or 4 years after that, it took about a 20% jump in premium increases. And after a couple of those, I got, I contacted the insurance commissioner to see if there wasn't some remedy. And of course, there's not. The insurance companies always win. And as you can probably note, I got fairly bitter about the whole thing because when I started off at $3,200 a year, expecting that would be more or less consistent, my last billing was $9,500 a year. And only by accepting a reduction in benefits was I able to keep the policy. So by reducing the automatic inflation coverage slightly, then I was able to get the policy back down to a little under $8,000 a month instead of $9,500. That's essentially the story. I'm happy to answer any questions about specifics later on.
Thank you so much. Kim Allen.
Thanks for having me. I'm Kim Allen. I have worked in healthcare for my entire career, and today talking to you a little bit about being on the other side of being a patient. And I am a lifelong Washingtonian. I was born in Skagit Valley, and I count myself among those annoying Pacific Northwesterners who are active and enjoy all the activities of our region. In my middle age now, I'm active in gravel biking, skiing, sea kayaking, and backpacking. And just last weekend, my wife and I finished a 40-mile gravel bike ride along the Forest Service roads in the Snoqualmie Forest. So this is a very common activity for us, but yet even as a healthy person and a former competitive rower, I was so surprised to be rejected for private long-term care insurance due to a pre-existing condition. But what's all the more frustrating for me, I was born with this rare condition called bladder exstrophy, and it was surgically corrected in childhood through a series of operations. But so it's infuriating now to be one of the millions of Washingtonians who won't ever be able to get private long-term care insurance and protect our retirement assets. And even if we can afford the expensive premiums, more than half of people are rejected by private insurance due to much more common conditions than mine, conditions like cancer and diabetes or even high blood pressure. But this is how long-term care insurance companies work. Unlike healthcare insurance, they can deny people like me with pre-existing conditions. And even though I felt I was doing everything right, taking good care of my health, staying active, planning well for retirement, saving enough to pay the expensive premiums, I was denied coverage because of this condition. What's even more sort of frustrating to me now is that there is an initiative, I-2124, on this year's ballot that is going to remove my only other alternative by effectively eliminating block hairs. If I-2124 passes, millions of people like me who are rejected by or can't afford private insurance will have nowhere to go. And in a worst case scenario, they'll have to sign over their homes or reduce their family's assets to less than $2,000 to qualify for Medicaid, even if they are proactive and do everything right, like I tried to do. As I mentioned, I've spent my career in healthcare advocating for patients, including helping cancer patients. I worked for Be the Match, the national registry that finds matching donors for leukemia patients, locally for BloodWorks Northwest, and now I'm a patient advocate at UW Medicine. I've seen firsthand what cancer patients go through, and including the huge loss of physical ability to perform even the simplest tasks of daily living. Personal tasks like showering or fixing yourself a sandwich, just safely walking to another room, a major sort of stressor every day for these patients is who is going to care for me? And finding those people, most we know, and as Bonnie mentioned, most of these people providing unpaid care are women. And I've seen many women have to reduce their work hours or leave their careers to assist family members, their spouses and parents, their children with leukemia, in-laws, people who can't afford to pay for outside assistance. And what most people also don't realize is that regular health insurance, Medicare, and private long-term care insurance won't pay for family members to perform that caregiving, even if they leave their jobs to do so. And I have to say, it's just an incredible and comforting asset to patients to have a family member help them. I-2124 is going to set us back and break Washington's promise to allow patients to choose who cares for them. Thanks for letting me share my story with you today.
Thank you for sharing, Kim. Jessica, you ready to share about the coalition and what's at stake here?
Yes, absolutely. Hello, everyone. My name is Jess Gomez, and I'm the director of the We Care for WACARES Coalition. Washington's long-term care benefit, or the WACARES program, is the result of more than a decade of work by community-led organizations in the state. This group of organizations eventually became the We Care for WACARES Coalition, and we continue to work to improve and protect the program today. Our coalition includes aging and disability organizations, provider and consumer-led groups, as well as individual activists whose lives have been personally touched by long-term care or the lack thereof. Some of our organizational members include unions of home care workers and nurses, the Washington Healthcare Association, Alzheimer's Association, and the MS Society. Following the creation of the program via legislation in 2019, the Long-Term Services and Support Commission that oversees the program held 27 public comment meetings to gather public input on ways to make Washington's long-term care benefit program even more effective. Like any brand new publicly funded program, changes and improvements are necessary and are currently underway. Legislators have implemented many of the commission's recommended changes, including covering near retirees, part-time workers, and most recently, making the benefits portable across states. Tomorrow, the commission will hold its first meeting of 2024 to continue moving toward implementation. Alongside the legislative recommendations made by the commission, Washington's long-term care benefit is also in its rulemaking process, another vehicle by which we can continue to tweak and improve the program to ensure that Washingtonians receive affordable and accessible long-term care beginning in 2026. But now, while we are working on improving the program before those benefits launch, we are also unfortunately fighting an initiative that would in essence kill the program, leaving people with pre-existing conditions, low and middle income families, and especially women and people of color stuck with a bill that tax-averse wealthy individuals do not want to pay. The proponents of this initiative chose a very ironic slogan, vote yes, pay less, when the hard truth is that if we continue choosing not to plan for long-term care, we may pay less right now, but we will end up paying much more when we are in crisis, needing long-term care, and can least afford it. Washington's solution to the long-term care crisis is gaining popularity in the broader national context, with 14 other states considering similar programs, including California, New York, and Pennsylvania. Experts across the nation studied the same issue, the same long-term care crisis, and came up with the same solution: a publicly funded long-term care benefit for all of the reasons outlined by the people here today. We cannot go back to square one, where working Washingtonians are forced to spend down their life savings to $2,000 or less in order to qualify for Medicaid. Unless you are a hedge fund manager, the status quo is simply unsustainable. Thank you.
Thanks, Jess. Thank you all so much for sharing. And now we will Any questions? Oh, Misha's joining us. Misha, we were just about to turn it over to questions from reporters, but if you would like to share, weighing in from your perspective on the impacts of the initiative on the Washington Long-Term Care Program, please do so.
Sure, I'll just be very brief, and apologies for the timing conflict. But I'm Misha Werschel with the Washington State Budget and Policy Center. I imagine that this has been, covered by the previous speakers, but the Washington Cares program, has the potential of really creating like a safety net for long-term care needs for Washington families, and also having a significant impact of reducing reliance on the state Medicaid program, which is currently the default payer for long-term care needs, which we know is half, funded through our tax dollars at the federal level and then half funded at the state level in Washington state. And so, would just note and draw attention to what I'm sure has already been shared about the analysis by the state actuary, kind of modeling different scenarios of adding in the requirement for folks to opt in to the Washington Cares program and the problems that creates with regards to adverse selection, likely driving up premium costs for those that remain and threatening the viability of the program long term, which we know will result in those costs not going away, because long-term care costs will continue to exist, but simply having those costs be kind of borne individually by families or by taxpayers through the Medicaid program. So just note that, which hopefully not too repetitive from what's already been covered.
Thank you so much, Misha. I appreciate it. Thanks for participating. Okay, any questions from reporters? Oh, Claire has her hand raised. Go ahead, Claire.
Hi, I had a question for Gifford. I just wanted to clarify, when, I guess initially, like, what was the maximum benefit that you were slated to get from your plan, and how much did that decrease when you decided to, pay lower premiums?
Gif, you're on mute, I believe.
Let's try that. My apologies. Claire, when we first bought our policies, we bought as good a policy as we could afford at the time, and it was a premium quality policy with what we felt was a premium quality insurance company, MetLife. And even though through the years of raising the premiums, the overall benefits had not been decreased until this year, when the increase was so substantial that they offered the option of reducing the benefits. That doesn't exactly answer your question, but to indicate that we have had and still have a relatively premium quality policy.
Yes, and I can share, there's somebody who's not participating in the briefing today, but who shared an experience of their mother's policy, which they pointed out, they thought that the total benefit amount sounded fine, that it should cover everything, but what they came to experience was the daily limit. So running up against that daily limit caused their entire family to have to pay for the care out of their own pocket anyway, even though their mother had a good benefit amount and policy. The family took the mother in and ended up paying to supplement all the care that was needed outside of the daily limit. Just another share. Any other questions?
Claire, this is Bonnie Burns. The experience that Gifford talked about is replicated all over the country by hundreds and thousands of people. All of the insurance companies that have written these policies since the early, since about the mid-80s through the year 2010 have had amazing price increases. People have been paying 80 and 90% more than once for the policies that they originally purchased. And that's unsustainable for most people. And so what they've done is to give back benefits to the insurance company in return for some premium that they could afford to pay. And a couple of the companies have gone into insolvency because of the mistaken assumptions that they made when they originally priced those policies. So this is not an uncommon experience, and many of the pools that exist across the country of companies who've written these policies are several thousand people to hundreds of people. And as the pool is shrunk because people either dropped their policies or they've died, those groups of policies are more and more unsustainable. So having a secure backdrop to all of this through the state, where people are paying a small amount of premium in order to have these benefits later, that's a real safety measure for families.
Thank you, Bonnie. Any other questions? Okay. Anything that any of our participants wanted to touch on, didn't get a chance to in your opening remarks that you wanted to share?
I'd just like to point out that we keep calling the Washington contribution a tax. It isn't a tax, it's a premium. People are paying that amount of money in order to get a benefit later. They do this same sort of thing with their state disability fund, which they probably don't even know they have because it's automatically taken out of their check before they ever see it. But originally, those programs caused a lot of controversies too, for a lot of the same reasons, is that people don't like to pay for something that A, they don't understand, B, they think they'll never use, and it's just a very confusing situation for people. But this kind of a program within a state is a real benefit for the people who live in that state.
Mm-hmm. Yeah, I can't remember who I was speaking with. Somebody said, well, back in 1930, was it 9, it was probably raised. Should we make Social Security, optional? That sounded like a reasonable idea. Well, if we had done that, can you imagine, where we would be now?
All of those social insurance programs have had a rough introductory phase for many of the same reasons. And it's just the way that people think about this. And with long-term care, people don't understand how much that affects their family, for one thing, but also our society as a whole. As people age, and we have larger and larger percentages in a state, it affects our economy in a lot of different ways. But long-term care touches so many different aspects of our lives. And people who provide this care are doing it in a silo. People don't know that that's happening in their family unless they know that particular situation. And there are literally millions of women across this country that are providing this kind of care quietly, without support, affecting their employment. And I've seen this happen with 3 of my daughters over the last 15 years. And one of those girls tried to keep her job. She came in early, she stayed late, she did all kinds of things to mitigate the risk to her own employment, and she was unsuccessful in the end, and she left that job. That means she is no longer getting a wage, so she's not contributing to her own security later. She's not saving so that she has savings or an IRA to draw from. And it's affecting her ability in the future to even pay for her own long-term care. And this is happening across the country. It amounts to about $22 billion a year in 2022 in unpaid care for family members. So it's a serious problem. It's going to get worse because the numbers of people needing this care are growing. And all over the country, some states are looking at this same issue. New York and Pennsylvania both have legislation. Several other states do as well. And it's going to be a national program without any response from the national government for this kind of care or for the problem that it presents to states.
Thank you for that comparison, Bonnie. I just wanted to add something there as you made the points about Social Security and Medicare. We're in a really unique position in the life of Washington's long-term care public benefit, which is people have started paying into the premium back in 2023, but they have not yet started receiving the benefit because we need some time for those monies to grow fiscally. So that puts us in this very precarious position where people have maybe felt it in their pocketbooks, but we don't have any stories to point to in the community of how this has benefited people yet. But very soon we will. And it is my belief that the proponents of this initiative are very much capitalizing on this moment in time because they know if they were to propose this initiative in 2026 or 2027, once people begin receiving this benefit, that it would fail miserably. But my belief is that eventually this benefit will become just as popular as those other public safety nets.
You know, I think reporters have a responsibility to start airing this issue across the country. And reporters can talk to people in Washington who are providing this care right now to their family members and ask them how that would affect their caregiving if this benefit was available to them right now. Because I can guarantee you that it would be enormously helpful to the women who are providing this kind of care every single day.
Thank you both so much.
May I add one more item there, Kristen?
Yes.
With respect to the initiative being already covered by our own long-term healthcare policies, I have to admit that I have not paid very much attention. But what I have read, and this is preaching to the choir, but I think there's not nearly enough information out there about the terrible damage this initiative would do to the very items that you folks are bringing up. I think that there needs to be a widespread information about the benefits of this plan, and also pointing out that it is not a tax, it's an investment. It's an investment in your future. And everyone has been pointing out, everyone is going to need to benefit, probably one time or another. Thanks.
That's right. Thank you for that addition. Judith, did you have a question? Claire has a question as well.
I just wanted to piggyback with what Bonnie said. There are people that say, and I've been asking around my neighbors and people I hike with, what would you do if you had to have 2 knees replaced, or you broke a hip and you were going to be convalescing for quite a long time? People say some things like, I'll get long-term care insurance, or I'll get on Medicaid. And so I just wanted to point out to the reporters in particular, in Washington, we call Medicaid Apple Health. It is not it's not a simple matter to get on it and to get that benefit because there's income and asset spend downs, and it's a complex program. And as Bonnie and others said, long-term care insurance, basically the whole industry of long-term care insurance is pretty unstable, and unaffordable. Those are the points I wanted to make. Thanks.
Thank you, Judith. Claire?
Hey, sorry, I don't want to monopolize people's time, but I did have just a couple other questions. And maybe this is a good question for Jess, but I am curious, given that this program, like Washington is the first state in the country to be doing this. But as you pointed out, like people haven't seen the benefits yet. Are there campaigns that you are looking to in other states or other examples of like how to sort of talk to people about this benefit? How are you sort of thinking about that issue or that sort of set of circumstances?
That's a good question. I mean, I think that we are in the unique and perhaps unfortunate position of being the first out of the gate. So we are sort of, building the messaging as we go along. And really, I think we're in the position of having other states watch how we're doing our messaging instead of the other way around.
Claire, Washington's Ben from WalkCares has made 2 presentations to the National Association of Insurance Commissioners over the last 4 or 5 months because of that group's interest in what states are doing. Minnesota also made a presentation about the efforts in that state. I'm beginning to create a database of states' actions involving some method of paying for long-term care. Some states have introduced legislation and then withdrawn it. Some states that introduced the legislation a couple of years ago haven't gone anywhere. The legislation that that New York just introduced is a reintroduction of a bill that they had introduced 2 years ago. And in all of these cases of legislation, they pretty much mimic the legislation from Washington. So there are about a dozen states that are doing something or talking about doing something about this issue. And it's because they've looked at the burgeoning population of people who are going to need this kind of care by 2030. And I'm happy to talk with any reporter about any of this. Just call me if you have any questions. And if I can't answer them, I will try and find somebody who can. Thank you.
Excellent. Thank you. Was there one more question, Claire?
Yeah, just to sort of follow up on what Bonnie was saying. I'm curious, Bonnie, if you've heard of folks in other states who are also watching this initiative effort and sort of, thinking about whether to create some similar policy, like based on what happens with the initiative. Like if the program gets made optional, does that sort of spell trouble for other states that are trying to do similar things?
Well, I think it will definitely discourage other states because they are not going to continue with something that won't be successful. And convincing politicians to do anything is a tough road to start with. But as I said, there are at least a dozen states watching this and looking for something to happen on it. And an initiative that would make this voluntary would discourage all the other states from doing something similar. I hope reporters pay attention to this issue because I think it's got a lot of permutations and different aspects of it. The two reports that are sitting in our state legislature are an actuarial report and a feasibility report that talks about 5 different ways the state could introduce a program to cover some of this care. And with each one of those options, there's an actuarial projection of the cost. And obviously, the the larger benefit that you have, the larger cost is going to be involved with it. And since this is a political issue as well, that's a tough balance. But I'm happy to talk with anybody about this and ways that we can solve it across the country. Thank you.
Any other questions?
I was just going to add on what Bonnie was saying. In the Affordable Care Act, there was a class act provision that was going to be a long-term care insurance policy for the nation. There were elements of it that were voluntary, and thus it was deemed financially unsustainable and was never actually enacted. So I think we know from our own experience that making programs like this voluntary will prevent it from being actually able to be sustainable. And so we don't have to look far. We can look at our own backyard.
Just a bit of history. The Class Act, which was Senator Kennedy's last bill, was modeled on a bill that he created 20 years earlier. It was the last time that the federal government seriously discussed long-term care and financing that kind of care, and that was in the 80s.
Wow.
Fascinating. I wanted to add one thing, for if I-2124 were to pass, I think I've seen a little bit of stuff in the press about this. Would people, get back the premiums that they have paid in? And I wanted to make sure reporters understand that the state has determined no, there will be no refunds for people at that point. People are some got exempted, others are still opting out for the exempted reasons of being non-immigrant visa holders, for example. They are not getting refunds. The ESD, which runs the program, does not have a way to provide these refunds. They don't have current worker, addresses, bank information, and so forth. So if voters need to understand, they're not going to get some short term, I'm going to get my couple $100 back or whatever it is that they've paid in. That is not the case, but workers also need to know they have started vesting in the program, and the benefits are going to become available should they experience the need for them in about 26 months or less. All right. Anything else before we wrap up? Thank you all so much for your time, sharing your experience, expertise, and personal stories. We really appreciate it.
Thank you, Kristen. Thank you, everyone.
Thanks all.